Hello, everyone. Welcome to our webinar series, which is being conducted by NETREACH. And today with us we have Atul, who is a public health professional with almost 8 years of experience in the field of sexual health. Atul also has a lot of experience when it comes to research, policy analysis, program implementation, and advocacy. Very happy to have you here, Atul. Thank you so much for removing time out of your busy day to do this with us. And yeah, just really thrilled that we could have you on board for this webinar session.
Thank you so much, Aishwarya. I could never say no to NetReach and Humsafar because I've started my work and my journey from Humsafar, and any opportunity that it gives me, it's actually I feel really privileged that Humsafar still reaches out to its previous employees, and the way they nurture us to grow, it really helps us, and it feels good to be back home.
Yeah, thank you for those very lovely and kind words. For our audience मैं ये बोलना चाहूँगी कि आज के एपिसोड में हम बात करने वाले हैं HIV के बारे में. In particular, we are going to talk about how we can navigate HIV. Living with HIV has a lot of, facets to it, and we are going to sort of try and cover it and how we can navigate life. So, Atul, from our experience, जो हमने हमारे outreach employee से सुना है कि a lot of times people get when they test positive, they get very stressed, they feel very anxious, they don't know what to do, they feel very helpless. So what advice would you give to someone who's just, very recently tested positive?
Aishwarya, before we go on to that, maybe we can just brush upon something on, how is HIV actually transmitted? Because it's time and again very, very important to reiterate, because that is where the crux of myth and stigma lies. That's the place where stigma comes from. So very quickly, we'll just talk about how it's transmitted. So basically, to all the people who are watching this webinar, HIV has three modes of transmission. That is from mother to child. When the second one is through infected injections, if someone is into drug use, or and that time if they are sharing infected needles. That's another. That's the second one, and the third one, of course, is unprotected sex. So basically, if you see, it is through a lot of bodily fluids like blood, semen, vaginal fluids, rectal fluids, even breast milk for that matter. So when we're saying this, we also have to think that what I mean, तो किससे नहीं होता? So खाने एक प्लेट में खाना खाने से नहीं होता, हग करने से नहीं होता, साथ में चलने से नहीं होता, एंड शोइंग अफेक्शन जैसे हाथ पकड़ने से या फिर किस करने से गालों पे नहीं होता इन्फेक्शन. तो दीज आर सम थिंग्स दैट वी हैव टू कीप इन माइंड, बिकॉज यही से तो इस मिस इन्फॉर्मेशन की वजह से बहुत सारे मिथ्स एंड स्टिग्मास कंटिन्यू हो जाता है ना. सो दिस इज समथिंग दैट वी ऑल्सो हैव टू कीप इन माइंड. एंड अगर किसी को समझो HIV हो जाता है तो फिर क्या होता है, जैसे आपने कहा से पॉजिटिव हो जाते हैं तो क्या. So there is ART. We have retroviral therapy, जो इंडिया में कहा जाता है. It is a very very good medicine. People who get positive need to start their treatment. जैसे पता चले वैसे आपको immediately तुरंत start करना जरूरी है आपका medication. एंड अगर आपको नहीं पता कहाँ से स्टार्ट करना है तो आप आपके नियरेस्ट क्लिनिक हॉस्पिटल्स में जाकर आप ये कर सकते हो. अगर आप वहां पे भी जाने से डर रहे हो तो आप कम्युनिटी ऑर्गेनाइजेशंस के पास जाके उनसे हेल्प ले सकते हो, एंड आई एम श्योर दे विल बी मोर देन विलिंग टू हेल्प यू. बट हैविंग सेड दिस, लेट मी जस्ट टेक वन स्टेप बैक. एंड हम इतना डरते क्यों हैं HIV से, या फिर HIV इतना हार्मफुल क्यों है? तो HIV जैसा हमें पता है और किसी तरीके से नहीं, इन तीन तरीके के अलावा और किसी तरीके से नहीं फैलता. तो इसलिए डर हार्मफुल इसलिए है क्योंकि जब वो हमारे बॉडी में जाता है, द फर्स्ट थिंग इट अटैक्स इज द इम्यून सिस्टम. या सो इम्यून सिस्टम बिकम्स वीक, एंड व्हेन दैट इम्यून सिस्टम बिकम वीक, अपॉर्चुनिस्टिक इन्फेक्शंस जो हम कहते हैं, जैसे ट्यूबरक्लोसिस हुआ या निमोनिया हुआ, उनके ज्यादा से ज्यादा चांसेस होते हैं इन्फेक्शन होने के. एंड दैट इज व्हाट makes you more vulnerable. कि जिसके चलते आपकी बॉडी और कमजोर होते रहती है। तो दैट इज वाई HIV इज हार्मफुल, क्योंकि वो आपकी इम्यून सिस्टम पे अटैक करता है। तो जैसे कि और ये आप बच सकते हो, या फिर इसको आपके इम्यून सिस्टम को आप वापस से रिपेयर कर सकते हो थ्रू ART। अभी जैसे सिंपल एनालॉजी के लिए अगर हम बात करें तो इट्स लाइक आपके पास एक कवच है, एक शील्ड है। HIV ने अटैक किया तो उसमें छेद हो गया, या फिर देयर इज अ चिप। बट ART की वजह से आप उस चिप को या फिर उस छेद को वापस से रिपेयर कर सकते हो। बट अगर आप ये कहो कि अगर HIV हो गया है और मुझे निमोनिया भी हो गया, मुझे TB हो गई, ट्यूबरकुलोसिस हो गया, तो मैं क्या करूं? ये चांसेस तब होते हैं जब आपकी HIV आपने अनट्रीटेड रखी है, जब आपने ट्रीटमेंट नहीं लिया, या फिर आप सही से दवाइयां नहीं खा रहे हो, तो ये इन्फेक्शन हो सकते हैं। और जब ऐसे इन्फेक्शन होते हैं तो आपके ऊपर डबल बर्डन, या फिर दो इन्फेक्शंस का जो भार होता है वो ज्यादा बढ़ जाता है। बट इसमें भी आपको डरने की कोई ये बात नहीं है, बिकॉज अगर आप रेगुलरली ART खाओ और उसके चलते आप उस इन्फेक्शंस की भी दवाइयां खाओ, तो आपकी इम्यून सिस्टम वापस से स्ट्रेंथन हो सकता है। तो ये तो है एक बेसिक चीज जो हमें याद हमेशा दिमाग में रखना है कि HIV होता क्या है। ये सबसे ज्यादा जरूरी है अगर हम HIV के साथ नेविगेट हमारी लाइफ करने वाले हैं तो। एंड कमिंग बैक टू योर क्वेश्चन, आई थिंक यू आस्क्ड हाउ टू नेविगेट लाइफ अगर HIV होगी तो क्या होता है। सो अगर कोई HIV पॉजिटिव हो जाता है, समझो आपने पहली बार टेस्ट किया या फिर आपने पहले बहुत सारे टेस्ट करे हैं और आप इन्फेक्ट हो जाते हो HIV से, तो अब मैं क्या सजेशन देता हूँ या फिर मैं क्या सजेशन दूंगा इज दैट सबसे पहले तो जब आप रिपोर्ट लो, आपके आई एम श्योर ये बहुत, आई मीन मोस्ट ऑफ पीपल एक्सपीरियंसेस, आपके पैरों तले जमीन हिल जाती है, बिकॉज जो स्टिग्मा है HIV को लेके, उसने आपके दिमाग पे जो इंफॉर्मेशन और वो जो सोसाइटल प्रेशर बिल्ड कर रखा है, उसके चलते आपको बहुत डर लगता है, आपको बहुत घबराहट सी होती है, और उस टाइम पे समझ नहीं आता क्या करना है। तो फर्स्ट थिंग आपको जो करना है वो है आपको एक डीप ब्रेथ लेनी है। टेक अ डीप ब्रेथ, इट्स इंपॉर्टेंट। सम पीपल माइट से अरे क्या बात कर रहा है, HIV पॉजिटिव हो गया है और डीप ब्रेथ लेने कह रहा है। व्हेन यू टेक अ डीप ब्रेथ इट काम्स यू डाउन। आप जब शांत होंगे तभी जाके आप नेक्स्ट स्टेप ले सकते हो। घाई में, जल्दबाजी में कोई नेक्स्ट स्टेप इज नॉट गोइंग टू बी वेरी इजी, आपको समझिएगा नहीं करना क्या है। तो अगर आप HIV पॉजिटिव हो जाते हो, फर्स्टली टेक अ डीप ब्रेथ। उसके बाद रीच आउट, जिन्होंने आपके टेस्ट करे, जहां पे आपने टेस्ट करे हैं वहां काउंसलर्स होंगे, आप उनके पास पोस्ट टेस्ट काउंसलिंग करवाइए। और फिर उसके बाद वो आपको ART सेंटर भेजेंगे। अगर आप कोई बड़े हॉस्पिटल में टेस्ट करवाए हो तो आपके ART सेंटर्स वहीं पे होंगे। अगर आप किसी छोटे रेगुलर आई मीन लाइक हॉस्पिटल में टेस्ट करवाए हो तो वहां पे आपको शायद कहीं और जाना पड़े। सो when you get tested, the first thing is seek counseling. Do not run away. रिपोर्ट लेके भागना नहीं है। Wait there, go for the counseling. It's very, very important. And after that, whatever questions, like, whatever you're feeling at that time, whatever the doctor tells you, listen and follow that. Sometimes now it is said that early diagnosis, early, medication पे डाल देते हैं लोगों को, सेम डे भी हो जाता है अभी कहीं कहीं जगहों पे। So get your treatment started as soon as possible. Stick to that treatment once that treatment is done. I'll tell you why this is important. बिकॉज जब आप ये होता है ना कि टेस्ट ले लिया, दवाइयां स्टार्ट करें, क्या करना है, जब आपको आपके बॉडी में ऑलरेडी एक इन्फेक्शन है और आपको पता चला है, तो आपकी बॉडी ऑलरेडी स्ट्रेस के अंडर होती है ना। जिससे आपको और आप बिकॉज ऑफ स्ट्रेस योर इम्यून सिस्टम ऑल्सो बिकम्स अ लिटिल मोर व्हाट यू से काइंड ऑफ बिकम्स लिटिल लो स्लो करके। तो आप अगर मेडिसिन पे जाते हो तो आपकी मेडिसिन एटलीस्ट आपकी इम्यून सिस्टम थोड़ा बूस्ट करने में मदद करती है, जो आपके वायरस को व्हाट यू से टैकल करने में आपकी बहुत मदद करती है। एंड जब आप जब आप उस फेज से निकल जाओ कि हाँ अभी मुझे पता है, मैंने अपने आप के स्टेटस को एक्सेप्ट कर लिया है कि हाँ मैं HIV पॉजिटिव हूँ, तो अब मैं आगे जाके क्या करूं। उसके बाद भी हमारे पास बहुत सारे सवाल आते हैं कि लाइक मैं टेस्ट पॉजिटिव हो गया, क्या मैं अब शादी कर सकता हूँ, क्या मेरे बच्चे हो सकते हैं, कैन आई गेट मैरिड, कैन आई हैव किड्स, कैन आई शुड आई टेल माई पेरेंट्स, व्हाट शुड आई डू? So, what you should do is, firstly, yes, you can get married. Secondly, yes, you can have your kids. And third, it is up to you if you have to want to tell your parents or if you want to tell your friends. Yeah. Modern medicines ensure that people living with HIV can have normal pregnancy, can give birth to children without transmitting the virus. तो आपके बच्चों में भी वायरस जाने की चांसेस बहुत बहुत कम या फिर नहीं होते हैं. And that is because आपने एक proper guidance ली होती है. That is why going to the counselor, taking that counseling is very very important. Don't run away from counseling. It is important. वो counseling लेना बहुत जरूरी है. And बहुत सारी stories है जहाँ पे mothers या फिर women जो HIV पॉजिटिव होने के बाद उन्होंने HIV नेगेटिव बच्चों को जन्म दिया हुआ है. एंड द डॉक्टर्स हेल्प यू, दे टेल यू व्हाट यू नीड टू डू, आपको क्या करना जरूरी है, आपको ट्रीटमेंट पे कैसे रहना है, क्या खाना है, कैसे मेडिसिन लेनी है, सब कुछ वो आपको बताते हैं. तो दिस काउंसलिंग जो मैं कह रहा हूँ आपको, और आपको ये भी समझने में बहुत मदद करेगी कि HIV अभी बाकी जैसे डायबिटीज हुआ या ब्लड प्रेशर हुआ वैसे वो अभी मैनेजेबल है बिकॉज ऑफ द मेडिकेशन. अगर कोई टेस्ट हो जाता है पॉजिटिव, तो आपको आपके काउंसलर्स, आपके हेल्थ केयर प्रोवाइडर्स के साथ पहले जाके वो सब बातें करनी है. और रही बात डिस्क्लोजर की, ये जरूरी नहीं है कि आपको इमिडिएटली डिस्क्लोज करना है. वो आपकी पर्सनल चॉइस है. जब आपको फील हो कि हाँ मैं किसी से शेयर कर सकता हूँ, मैं मेरे दोस्त से शेयर कर सकता हूँ या फिर मैं अपने फैमिली से शेयर कर सकता हूँ, तब ही जाकर आप शेयर करें. बिकॉज अगर उनका रिएक्शन नेगेटिव रहा या फिर वो नहीं रहा जो आपने एक्सपेक्ट किया है, तो वो और आपको मेंटल स्ट्रेस देगा. बहुत सारे लोग आपको बोलेंगे कि HIV हो गया है, घर पे कब कब बताएगा, या फिर घर पे बताना जरूरी है. इट्स ऑल अप टू यू. इट इज यू हु शुड डिसाइड. यू हैव टू टेक दैट डिसीजन कि क्या तुम तैयार हो. तभी आप जाके एक फ्रीली, एक ओपन माइंड से आप जाके बात कर सकते हो. और आपको इन सब चीजों के बारे में, डिस्क्लोजर के बारे में या HIV के बारे में कोई भी सवाल हो, आपको नहीं, आप में हिचक है कि मैं क्या क्या जाके पूछूंगा, मैं भूल गया, तो राइट इट डाउन. राइट डाउन ऑल योर क्वेश्चंस. आपका जो डर है, जो आपके सवाल है, वो आप आपके फर्स्ट चेकअप के टाइम पे जाके डॉक्टर से बात करो. वो सब लेकर जाओ, वो सब बातें करो. एंड आस्क देम एज मेनी क्वेश्चंस एज यू वांट, बिकॉज दैट इज व्हाट दे आर देयर फॉर. यू शुड आस्क ऑल योर डाउट्स. Later on, when you have more doubts, you can go back in a second checkup, your third checkup, पे जाके you can ask your other doubts. But initial stages के जो doubts है, do not shy away. Do not fear the counselors. Do not fear the doctors. They're there to help you. Yeah. And when you take when you are proactively taking steps to write down your questions, it also will make you feel that you are doing something for yourself because you want to live a better life. You want to lead a fulfilling life. This will also help you ease with some of the anxiety.
Thank you so much for that answer, Atul. I think, as you rightly said, I think it's very important before we talk about HIV to understand how it is transmitted and, point where you mentioned the myths around HIV. That is very true, because HIV ke around you get to hear all kinds of things like people say that HIV मच्छर काटने से हो जाता है या
Hmm.
HIV का क्योर आयुर्वेदिक मेडिसिन से हो सकता है. All these things are obviously not true. या another popular thing जो बहुत सुनने में आता है कि if during oral sex you don't really need to wear a condom because you
Hmm.
cannot get HIV by having oral sex. या फिर in the gay community or in the MSM community specifically, they have the whole thing about top and bottom, and the whole myth around if I'm a bottom then I don't really need to wear condom because I'm on the receiving end. So I think essay also there are a lot of like myths, such myths because of which prevent people from one, indulging in safer sex practices. Two, it also creates stigma, which you rightly mentioned. The
Mhm.
other thing, when you were talking about ART, this is one question that came to my mind, क्योंकि जब हम ART के बारे में सुनते हैं, the other term that we often get to hear closely with ART is U is equal to U. So if you can
Hmm.
talk a little bit about U is to U and explain to the people कि concepts like viral load क्या होता है, viral load कम undetected होना क्या होता है, and the other question is, do you think that having STIs how does that impact your viral load, and how does that sort of work?
Okay. So, as you mentioned correctly, yes, there's a lot of myth. बहुत सारे myth है कि like if you're a top and if you're a penetrative partner, you cannot get HIV. That is wrong. As I said, it is exchange of body fluids, be it a top or a bottom. If there is any form of exchange of infected bodily fluid, then the person is going to get HIV. HIV tab ho jayega. That is, there is no rocket science behind that. And रही बात about oral sex से HIV नहीं होता, the chances are very very low. Again, it depends upon U is equals to U, and also if there is any blood, if there is any cut in your mouth, or if any there is an open wound in your mouth, and if there is an infected person you are having intercourse with or oral sex with, and that's when there is exchange of fluids, then HIV does happen. But as I said, the chances are low. However, HIV is not the only thing that we need to worry about, right? We also have STIs. We have gonorrhea, which is very rampantly becoming drug resistant, which basically means he very there are limited drugs, but there are higher percentage of people becoming resistant to drugs who are infected with gonorrhea. So there is a lot of STIs that we also need to worry about, which also connects us to our other things like, if STI ho gaya, so HIV ka kya scene hai? What happens is any infection basically will primarily attack your immune system. If there is someone who's infected with an STI, then there are higher chances for that person to also get HIV very easily in that period. But also the other thing is that if you have an STI, there could be chances that you already have HIV, because there are some STIs, I think, if I'm not mistaken, I think chlamydia and gonorrhea. These infections mostly happen to people. Mostly, I'm not saying that this is how it happens, but there are chances that the person may have HIV, and then these infections were the co-infections. So that is where regular testing is also very very important when it comes to HIV or STIs. And that also, as we mentioned about U is equals to U, and of the whole scenario around it, and ART, and all of these are very big jargons. Logic simple hai. You take ARTs, which is antiretroviral therapies, right? Which is basically antiretroviral. So it is the drug that is going to be against the virus. And when that drug is working in your body, it suppresses your viral load, or viral load is basically the amount of virus in a certain amount of drug. So there is some parameters to it, there are various tests for it, and if that number reduces to undetectable levels while you're getting tested for viral load, that is when you say it's undetectable. So undetectable, that is U, equals to U. The other U is untransmittable, so it will not get transmitted. Here, the other best part is that if it's undetectable, it basically means it's also not acting in your body. So it is there in your body, it is there somewhere in your body, but it is not acting. So it's not affecting or other organs. It is not affecting your, the larger immune system, because the medication is helping you suppress them. So that is why, again, treatment is very important. Going on treatment is very important for you to become U is equals to U. And as I mentioned earlier, normal pregnancy or pregnancy where you do not transmit, infection to your fetus or your child, your baby, is when U is equals to. So even if HIV infected man, his viral load is undetectable, undetectable, then the virus will not transmit to the wife, baby who doesn't have HIV. So that is how U is equals to U works. Also, if you are a gay man, MSM, or if you're a gay man and here U is equals to U basically is very useful to understand when when you are engaging in sex, and that time if the condom breaks, so you know that your viral load is suppressed. So there are higher chances that you've not transmitted any infection to the person because your viral load is undetectable. So that is how U is equals to U, helps you in your relationships also. That when you are undetectable and when you're going out dating or you're seeking a relationship, you can actually be a little more confident that you will not, you can keep your partner safe. And when we're talking about the dating scenario here now, that's when the other concept comes in, PrEP. That is pre-exposure prophylaxis, right? So ART, when makes you undetectable, also, see, again, there are chances that, by chance, if when you are interacting, you just got tested maybe for your viral load a year ago, but now you have not done your viral load test. And by at that time, maybe it doesn't happen usually, but just in case your viral load is not suppressed and it has it has bleeped because you missed a certain amount of doses or something like that, and your condom breaks and you transmit the virus to the partner. PrEP comes into play then. So it is advised that if you are HIV positive and if you want to seek a relationship, if you're meeting someone, it would be good advice to talk to them about these things. Maybe first understand if that person how that person is, if he's someone who with an open mind and who's going to understand what you're trying to say and not stigmatize the whole HIV thing again. And then you disclose him your status in confidence, after bringing him in confidence or understanding that he will be someone who will, even if he reacts in a very harsh manner, he won't go and tell out, you know. So it's like, when HIV also makes you wiser, let me tell you that, because there are a lot of people who understand, with whom they want to go out, what kind of partner they seek, what kind of maturity level they want. And based on that, when you understand that person's capacity to understand HIV and the whole notion of HIV, including PrEP, PEP and everything, is when you can disclose your status. और जब आप ये करोगे, जब आपको समझ में आता है कि आपका पार्टनर या आप जिसके साथ रिलेशन में जाने की सोच रहे हो वो ओपन माइंडेड है, तो आप उसको बता दो। और जब आप ये बता रहे हो तब आप उनको, यू कैन ऑल्सो टॉक अबाउट यू इज इक्वल्स टू यू। When you talk about U is equals to U, the conversation can automatically lead to PrEP. So PrEP is basically pre-exposure prophylaxis, where the person has to take, start a medication. There are some event-based PrEP also. I personally do not recommend that. I always, people who ever reach out to me, I always tell them that, go on a proper course where you are sure that, there is a certain level of PrEP medicine in your body, which is going to help you or your body fight the infection if it enters. So it's where after you start PrEP, it takes around 7 days for a certain level of the medication to reach in your body. After which, if there is an infection that enters, then PrEP can take care of it. And even when you are wanting to stop PrEP, you have to still continue for 7 days. So reach out to the doctors or the counselors, and they will definitely guide you in a better way, because there are tests that one needs to do around, before they get on PrEP, to understand if there is any, imbalances in your body, and if you have any, what do you say, any infection, because PrEP is taken by HIV negative people. If the person is already HIV positive, तो इट इज पॉइंटलेस, तो लेकर कोई मतलब नहीं है। HIV नेगेटिव होगा तो ही उस पर प्रेप काम करेगा। अगर प्रेप पॉजिटिव इंसान लेता है तो इट्स एक्चुअली पॉइंटलेस, बिकॉज इन्फेक्शन तो हो चुका है। So that is basically one needs to, that is when disclosure comes into play. And as I said, go back to your counselors, go back to people you who are providing services for HIV and STI.
Yeah, thank you for that insight. I wanted to say, that line that you said that HIV makes you wiser. I think that's a very interesting perspective to look at it because it really, in some ways, it really does because you are a bit more conscious of who you're picking, like your
Yeah.
partner, right? Because it is sensitive information that you're going to share with them, and then you do have to take into consideration that like you just have to be very vulnerable with
Yeah.
someone to share that information and also make sure that they are someone who will be able to handle it, as you said,
Hmm.
maturely. And that's a very interesting take. Also just very interesting take on dating in general. um, but I also wanted to bring out, like, talk about certain things like जब because हमने इस webinar के through we talked a lot about stigma, and it's
Hmm.
true, it is, I think it is painfully difficult, I think. And I think stigma, I feel like it happens at different levels, right?
Hmm.
Because I think first, I feel like for a lot of people, when they have just tested positive for HIV, there's a lot of self stigmatization that happens because
Yes.
they themselves are in that, in their whole spiral where because they also just don't have the right information. And जैसे
Correct.
आपने बताया कि once you reach that stage of self acceptance where you realize that, okay, no, this is very much manageable, I just need to take a few medications and I'll be good, right? It's
Yeah.
as you very nicely put that, it's just like having diabetes or maybe having to take medicines for BP. It's similar to that. But
Yeah.
I think a lot of people also struggle because while you might understand it, the world may not catch up to you and they might not
Hmm.
understand, right? So in that scenario, it go having taking care of your mental health and being able to go to a counselor, as you said, rightly said, कि counseling बहुत important है, and not to run away for it or not to shy from it, because I think they really help you and guide you on how you can sort of navigate the situation. So in
Hmm.
that, I totally agree with you that it's very important to sort of have to
Hmm.
have a counselor, not just having a counselor but also basic knowledge of like just knowing where the nearest testing center is to you, right? So having
Yes.
those little bit knowledge here and there, I think it sort of really helps when it comes to the bigger picture. The other thing, there are two things that I wanted to ask you. One is if you could just talk a little bit about the laws that are in place when it comes to HIV, which can sort of empower people. And the other thing that I wanted to ask was, आपने अभी PrEP के बारे में बात किया, which is essentially a medication that people can take that helps prevent them from getting HIV. But a lot of times हमने
Hmm.
ये देखा है कि because people are on PrEP, they just don't wear a
Hmm.
condom. They don't understand. Like, I feel like there is that myth that because I'm on prep, I don't need to wear a condom. And जैसे आपने rightly कहा कि बहुत सारे STIs increase हो रहे हैं. Like there is gonorrhea, there's chlamydia, there's herpes, syphilis, genital warts. All these kind of STIs are increasing rampantly because of this misinformation that is there. But we'll just take a short break, and after that, we will
Sure.
just, get to these two questions and the rest of the things that are in
Sure.
line.